Hi everyone, my name is Lala Abdenia. Welcome back to my channel. Today we'll be talking about a very important topic, which is overcoming health challenges of working from home. Overcoming health challenges of working from home. Today I've got a very important guest in the house, but before then, why are we exploring this topic? Study has shown that the number of those that are working from home has dramatically increased, and that's no surprise. So today we're going to be looking at how we can overcome some of the health challenges that people are facing. So today I've got an important guest in the house in the name of Dr. Adebalu. So Dr. Adebalu, welcome to my channel.
Thank you. Thank you for having
Please,
me. Thank you
welcome.
for having me on your
Please,
channel.
you're welcome. So please introduce yourself. I'd love to know a little bit about you.
Thank you, Lola, for having me on your channel today. It's good to be here. I've watched so many of your series and they're very educative, and I'm so happy to be here. My name is Dr. Oluwaseun Adebulu, and I'm a general practitioner. I work in the Republic of Ireland, Dublin. I've been practicing medicine for over 12 years now, and I majorly specialize in women's health. I have my specialty in family medicine. I have my master's degree in public health, and I've done quite a number of certifications in child and mental health. So that's a short biography about me, and it's a privilege to be here with you today.
Wow, that's incredible. The shift to remote work has been life changing for many adults, for many working adults, especially for those who are caregivers to families. And we know that every good thing also has its own side effects. So, what are some of the health challenges that people are facing as a result of working from home?
Okay, thank you, Lola. That's a very good question. And I must say that since post-COVID, there's been a huge shift, in the working situation of people. And you see a lot of companies encouraging, even their workers to work hybrid, some time in the home, some time in the office. And this is just to tell you that things are just changing globally. However, like you said, every good side of it also have its own, downside. One of the good side is the fact that people who have young families are able to manage their family. There's a huge cuts of expenses in terms of transportation, and people could, manage things properly. I mean, in terms of balancing their work and family life properly. However, having said that, there's been a lot of challenges with, it as regards to the health of people, especially for people who now work from home. And looking at this topic, to be honest, like it's really very broad, because even in my practice, I've seen a lot of people who come to me with some illnesses that on a good day they didn't really have it while they were working actively, going to work every day. But because now they work from home, they couldn't manage their health, and working from home properly, they've started to develop some of these health problems. And one of them is weight gain. I mean, like, because working from home, it encourages sedentary lifestyle. I mean, you can easily go to your fridge and grab some food to eat at any.
Yeah.
You could, there's no. Sometimes you don't even have to. There's no proper scheduling of timing to eat. You
Yeah.
can just breakfast in the morning at maybe 11 o'clock, and eat
Mm.
till 12 o'clock, and have
Yeah.
dinner as many times as possible
Yeah.
because we're working from home. So because of that, you see a lot of people have gained a lot of weight because of working from home. But having said that, I think to put it in perspective, it will be important to just divide these challenges into subgroups. I would just say you could have physical health challenges, and we just say mental health challenges. And looking at the physical health challenges, it starts from even the working position from home, the way you're working, the way you're seated behind your desk. If you're not seated properly, if you're not using the appropriate type of desk to work, if you are not using the appropriate type of chair to sit down, you could develop what we call musculoskeletal problems. And these are problems within your muscles, these are problems within your joints as a result of inappropriate sitting position. Okay. So sometimes you see a lot of people, especially when they are working with their computer, they have their head is bowed down all the time because they are typing. A lot of people are developing what we call cervical spondylosis. This is just the wearing and tearing of the joints of your neck or the cervical spine. And instead of people come to me. I've seen this, occurrence every time. Oh, doctor, I'm having pain in my neck. And sometimes you have done x-rays, you've done MRI, really nothing is showing. It's just because of bad posture from long-term, bending of the neck as a result of work. So that's another problem. Another problem could be lumbar pain in the back. If you're not using an appropriate type of chair to sit down, you could develop pain within your back. So you could develop pain in your back, and especially if you're not using the right type of chair to support your lumbar area. Okay. Other types of physical health challenges you could get is problems with your eyes, because you're also, glued to the screen most of the time, that you could develop eye straining from that. Your eyes begin to strain a lot. I mean, you strain your eye a lot because you're looking at the computer all the time, and a lot of people have developed eye problems from that. And also because of the blue rays that comes from the screen, it affects, damages the retina. So long-term exposure to that blue ray could cause problem with the retina. So you see a lot of even young people coming down with a lot of eye problems. People who originally are not using glasses now have to wear glasses because they have to sit down behind the computer for a long period of time. And to be honest, I mean, some people will say, okay, but then we'll go to work, we still work on our computer and all of that. But study have shown that really, Lola, to be honest, study have shown that people tend to sit down on their computer more at home than they do in the office. Because if you go for your 9 to 5 work, you know that, okay, after 5 o'clock, I'm going home, I'm shutting down my computer, I'm going to rest. But it's not the same for people who work from home. People can decide to say, okay, look, I can work into the midnight and finish the tasks at 10 o'clock. So the reason there's no time bound when you work from home, except people who really discipline themselves very well.
It's very relatable. A lot of people are working from home can relate to this. You're actually doing more than you should be doing on a normal day. And a lot of times you're just stuck behind your computers and you just have to continue to work and work and work. 54% of those that are working from home have said that their movements have decreased by 50% over the past year. So what you're saying is very true. It's very, very true.
Yeah, I mean, like the studies are there to show, I mean, what people are experiencing. So, and I mean, looking at it from even my own, I mean, judging from the reality of what we see every day in the clinic, you could tell that a lot of people, and if you look at the people who actually are going through this problem, are younger age group, younger people who are now, especially people who are in the IT sector, people who are in the maybe the business sectors, and they can also work from home. And you see a huge younger age group coming down with problems with their back, problems with their neck as a result of inappropriate sitting positions or sitting down for a long period of time. Another problem is poor circulation. So because people sit down for a long period of time, there's what we call stasis. So the blood is not circulating around the body as it should be. And as a result of that, you see a lot of people come down with a lot of problems with their nerve. So people can complain of, oh, doctor, I'm having numbness in my leg. I'm having numbness in my hand. I can feel this tingling sensations. So there's a lot of nerve problems, that have been associated with working from home as a result of, sitting for a long period of time, reducing the circulation of blood around the body. As you can see, I mean, if you go to work, you're very active, you're jumping from one desk to the other, you think, colleague, you're going out for lunch, you're doing things, you're communicating with people,
You're driving, getting on the bus.
all of these help with circulation, even unknowingly. But now that people are working from home, there's a
Yeah.
huge health challenge that has been associated with working from home.
I think you said a whole lot of things there because I can just relate to some of the things you've been saying. A lot of times, I just feel numbness on my leg and I'm stopping my
Yeah,
feet. So I can
yeah,
now understand that it's as a result of circulation. Thanks for
speculation.
that.
Yeah,
Yeah. I
yeah.
think you
And
mentioned that there are mental.
yeah, so there are other, I mean, there's a mental health challenge associated with working from home. But before I go to the mental health, I think there's another common physical challenge, health challenges I would like to also talk about, because you see, because these are things I see, every day in my practice, is tension headache. A lot of people come down to you and they complain about, oh, doctor, I'm having headache. They can't explain it, unexplainable. Sometimes they think it's migraine, but realistically, when you take a good history from them, you find out that it's tension headache, which is associated with, working from home and working long hours from home, glued behind the screen. So I've mentioned a few physical things now. Musculoskeletal pains could be from your neck, it could be from your lower back area. It could also be from your eyes. A lot of people have experiencing strain in their eyes, dryness in the eye as a result of constant exposure to the blue rays coming from the screen. And the third one that I mentioned is poor circulation, and the last one there will be tension headache. Now, looking at the other parts of challenges that you can get from working from home is the mental health, which is a huge one. And this is a problem that's, because it comes subtle, people kind of misdiagnose this. People don't even see it coming until it has really, really escalated. And one of the first mental health problem I'll talk about is stress. Stress. So because sometimes people find it difficult. I'm like, oh, is stress a mental health problem? But to be realistic, stress is a main stressor for most of the mental health challenges that we experience. A lot of people are burnt out from working from home because because they think, oh, I'm working from home. It's nothing. I will do it later. I can do this later. You realize that you keep doing so much, and because you're working from home, sometimes you feel that, oh, I'm not even doing enough because, oh, at least I'm working from home. Maybe I'm not doing enough. Maybe I can do this. I can still do this more. And because you're taking so much, at a point you just get burnt out and you can't just explain it. So, and I've seen a couple of times patients come to me and they tell me that, doctor, I don't feel like, I just don't know how I feel in my body. I feel like I'm not sleeping very well. I'm not eating very well. I'm not. All these are burnt out from, could be as a result of burnt out from overly working yourself out from work. And what stress does is that over time it progresses to anxiety. Now, because you're under so much stress, you want to get so many things done. At the same time, you want to satisfy maybe your boss or your supervisor. You want to meet up with targets, and you're wondering, I'm not even sure if I'm doing enough. Before you know it, anxiety sets in. You're not sleeping very well. You're sleeping late. Your exercise time in terms of walking, burning out few fats from your body is reduced. You're probably not even eating the right type of food, and before you know it, you become very anxious. And if anxiety is not well managed, it can lead to what we call depression. And basically, depression is simple terms. You're just losing your mind. That's the way I say it. You're not sleeping very well. The things that naturally will interest you, you're beginning to lose interest from them. The things that you love to do, you're not doing them anymore. You're not, socializing with people. Because really, like when you're working from home, there's poor, your social life is impaired already. Your colleagues that you meet on a daily basis, that you talk about secular things, you talk about
Yeah.
family. I mean, there's nobody to talk to. The only people you're talking to is maybe your spouse if you're married, or
Yeah.
maybe now that's the only person you're talking to. And sometimes you just want to talk to another person because sometimes you feel they're not even relating well with you. They're not even understanding what you're saying, especially when you're not even in the same line of job. So when you're having challenges at work and you just need somebody to talk to ask question,
Yeah.
you can't really. I mean, because the person is not there, you can't really. There's nobody to talk to. So it becomes very challenging for you. And because of that, anxiety sets in. And if anxiety is not well managed, it could lead to depression. And from depression, you could start having, you know, a lot of societal thoughts, because we see a lot of people that are going through depression, and because the depression is not well managed, has caused, has led to suicide.
I agree 100%. A lot of people are struggling with maintaining work-life balance. And we begin to know what are the tips for setting boundaries and also to prevent burning out. We don't want to burn out.
But all those things are really interwoven, because there must be a way to balance everything in
Mm.
such that the health will not be
Yeah,
affected.
yeah, it's a very good one. In fact, you said a lot of things there that a lot of people should be aware of. So, health experts, like yourself, they're concerned about the impact of depression, anxiety, it's causing on families and people that are working from home. So, you've told us the challenges, the problems, but what are the solutions? I'm sure my audience will be very keen to know. So, what are the solutions to all these problems?
Okay.
And as
Yeah.
the remedy.
Okay. So we quickly talk about the remedy. There's no problem without plausible solutions. Now we've talked about the physical challenges. This is what I tell my patients, and I also tell my husband at some that you need to have a schedule work plan for yourself. You need to plan yourself as if you need to plan your work as if you're working in the office. Your work has to be well scheduled. Okay. So you need to have a work plan for yourself. This is the time I'm going to sit down behind my desk, and during my lunchtime, I'm going to take my lunch. I'm going to go for my lunch. I'm going to go for a walk. So this must be a time planned. Your work schedule must be well
Yeah.
planned.
Oh,
Okay.
that's great.
Yeah. The second thing is that you need to get the appropriate tools. Oh, don't say because you're working from home, you can't tell your office to get you the proper desk. You need to tell them. You need to be able to communicate to the
Yeah.
HR that, look, I'm having challenges here with my back. I need a proper chair that can support my lumbar. So there are some
Yeah.
chairs that has what we call the lumbar supports. So
Yeah.
they support the lumbar area. They support your lower back to give you that cushion, so that you don't have the lower back pain from
Yeah.
sitting. The way our back is formed is
Yeah.
curved, right? So when you don't have anything to support the lower back,
Yeah.
it's putting a lot of stress, and you are causing deformation of that curvature, and that could cause problem later.
Wow.
So you need to get a proper chair. The same thing with your desk, your working desk. You need to get a proper work desk. It's such that when you're sitting, you're looking straight up into your computer. You're not looking down. You have to be looking straight,
Yes.
so that your neck can be well supported.
Yeah, that's good. I think a lot of organizations do have procedures for this.
Yeah.
And I think I remember when I started my last job, everything was perfect. They were like, do you need this type of chair? You have to select the type of equipment and tools
Yeah.
that you think you need. So I think most workplaces do offer that support.
Brilliant. Yeah.
Yeah.
Yeah. So people really need to ask, they need to explore that option.
It's
And even for people who are already experiencing low back pains,
Yeah.
and sometimes you need to stand up to walk. So there are some desks that are adjustable that you can lift them up.
Yeah. Yeah.
You can actually get that to support yourself. You can take a break from your sitting position, stand up to help your back, and you can adjust your table or your desk up in order to support yourself, and you can stand up, walking for a while before you take a seat. So these are small measures that you can do to prevent, you having any form of neck pain or back pain, right? Then the other thing is that for people who have not developed eye problems, you need to protect your eyes very well. So if you need to get, I think there are some things you can put on your computer to help reduce the reflection of light into your eye in order not to damage your retina. So you can also look into that. Maybe you need to talk to your company to give you that kind of support.
Yeah.
And so you could get the appropriate types of, for people who already have eye problems. So they probably need to speak to their opticians to give them the appropriate type of glasses to be able to work with the computer. Most of the glasses for the computer has what we call the anti-glare. So this kind of reduce the effect of the blue rays, coming into the eyes. and affecting and damaging the retina. And the other thing is that, like I say, you need to really learn how to do a work-life balance. So, because one of the problems I talked about is poor circulation, and I forgot to mention to you that with poor circulation, as a result of sitting for a long period of time, it could also lead to high blood pressure, lead to diabetics, and all of that. So there's a lot of metabolic problems that is associated with working, remotely and sitting for a long period of time. So you need to, by yourself, get some time out of your walk, out of your sitting position, try and take a walk around. You could decide to maybe every 10 minutes, you have to get a plan for yourself. Maybe every 30 minutes of sitting down, I'm going to go for 20-minute walk and I'm going to come back. Or maybe every 1 hour of walking, I'm going to get 20-minute break or 10-minute just to walk and stretch your leg, improve your circulation in order to reduce these health challenges. Lastly, in terms of the mental health, the main cause of the mental health problems I've talked about is stress as a result of overworking yourself because, okay, you have so much to do and you think you're doing it from home. You think you have the time, but really there's no time. So you need to reduce the stress. And one way to reduce that stress is to also have a plan. I mean, plan is everything. You need to get a work plan for yourself. This is what I need to do. And when it's 5 o'clock, I'm shutting down my computer. I'm doing other things. So you need to get a work plan. Other problems that causes mental health is lack of, socializing problems. So you need to find time. So, go out, with friends and families that are around. You need to socialize with people to help reduce the stress of work. Then in terms of sleep is also a major problem for mental health problems, especially depression. We're not sleeping very well. You could be depressed. So you need to have a good sleep hygiene routine. When it's 10 o'clock, when it's 9 o'clock, whatever you decide for yourself, I'm going to bed, I'm shutting down my computer, shutting down my phone. Nothing is going to disturb me. I'm going to sleep. So all this would help to improve the quality of life. For people who take a lot of caffeine, stimulants to work, you need to start cutting them down because they could also have a negative impact on your sleep pattern, which could invariably cause, mental health problems.
Wow. Incredible. So I think from all that you said, it seems to see you have to be intentional about what you want to do, you want for yourself. Remember that you won't work forever. It's time to come that all of these health challenges and issues will take over your life if you're not careful. So you've heard it from the experts. Take time to exercise. What about eating good food? Does that happen?
Absolutely. You need to, it's all about work-life balance. You need to eat appropriately. You need to do the right time. I said it to that. One of the problems that even causes depression is weight gain because people just eat any form of junks and they start adding up weight. So you need to eat the right type of food. You have to be intentional about it. I'm going to drink water. I'm going to eat my fruits and vegetables. I'm going to have my breakfast when I'm supposed to have my breakfast. I'm going to have my lunch when I'm supposed to have my lunch. I'm going to have my dinner when I'm supposed to have my dinner. It's all about planning and eating the right type of food. Life is all about planning. A lot of people who don't plan their life, they end up doing things as they come. They just help them taking up things, responsibility roles as they come. And all of these could affect your lifestyle and your quality of life. So planning, you need to plan your health, you need to plan your life, you need to plan your work. Your life is in your hands and you have to plan it by yourself.
Why? It feels like your life is in your hands. So you heard that. So thank you very much. Do you have any last word for our audience? Because you've given us one.
There must be a clear separation between work time and home time. When it's time for work, you work. And when it's time to do other things, you do it. Life is very short. You can't solve every problem. You can only do what you can do at a time and leave the rest for another time.
Wow, I think you've had it. So thank you very much, Dr. Tebolu. I'm sure a lot of people will be blessed by a wealth of knowledge and experience and insights.
Thank you for having me.
Thank you very much. It's a pleasure, and we'll see you on our next episode. Very important. Your life is in your hands. to prioritize self-care, prioritize your mental well-being as you welcome home. I'll see you in my next episode.